What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test or a flu test, RSV, norovirus, anything that you had to take a test for, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, November 1st, 2024. That's right, we have now entered a new month. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that could make you sick. Let's face it, there's a lot of them out there, and some of them are starting to increase again. Flu? Yep, it's getting to be that time of year. Flu is starting to increase. Do you want to stay informed with what's going on with all these viruses? Well, then just subscribe down below, give this video a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Today we will talk about some news stories. We'll take a look at some daily data. We'll take a look at some state reports for this week. And of course some CDC data. And yes, I think we are going to take a look at some wastewater sites today as well. Starting off with the news. This is rather interesting but concerning at the same time. In Oregon, they are reporting 3 humans with bird flu traveled to Oregon during the Washington outbreak. So 3 humans who had bird flu from Washington made their way over to Oregon, which is not a good thing. Come on, folks. If you are sick, stay home. It is really simple to do. There is no reason to go out and potentially spread other viruses. And a quick reminder, there has been no confirmed in the United States human-to-human transmission of H5N1 virus as of yet. Alright, this is something that's bothering me. I was just informed of this earlier. A friend actually sent me a screenshot about Idaho, and I was going, what's this say? And I'm reading, really? Idaho and some health departments in some areas are not going to be allowed to give a COVID vaccine anymore, or a booster? I mean, it should really be whoever wants a booster can go get a booster. If you don't want one, fine. That's your business, right? Am I wrong? It says an Idaho health department isn't allowed to give COVID-19 vaccines anymore. Experts say it's a first, and yeah, it is. I mean, we've had the Florida Surgeon General advise not doing it, and then we've had advertisements down in Texas, from my understanding, saying that you really shouldn't do it, but a ban? This is a first. I mean, it's just totally ridiculous. It shouldn't even be a thing. If you want to get the vaccine, fine. If you don't feel safe getting it, or for whatever reason, not trying to be anti-vax by any means, if you don't want to get it, that's your business. Get it? Alright, I just really don't understand why they have to take these things so political, but they do, and it just bothers me. Alright, measles cases in Italy. Yeah, we have an update on that today. This is something that I wasn't expecting to see, and something that's pretty bad. 2023, Italy had 44 cases. 2024, 897 cases. And that is just during 2024 till September. Already recorded 20 times the cases more than 2023. Oh, that's just terrible. The COVID-19 pandemic has made people more reluctant to go out study fines. Well, this is kind of true for the COVID cautious community, which, quite frankly, is not a bad thing, because it's dangerous out there, especially people who deal with long COVID. I mean, God forbid you deal with long COVID and now you're immunocompromised, or people who were immunocompromised before COVID. If they get any type of infection now, it can be dangerous. If they get reinfected with COVID, it can really be dangerous. And one of the things I am hearing, unrelated to that, or maybe it is related to that, is a lot of companies, when they're taking job applications for people that are being hired, a lot of people are asking for work from home situation, a work from home life, or a hybrid model where you work in person 3 days and then you're home 2 days, or something like that. Yeah, and you know what? People are reluctant to go out. There's a lot of cases, other than me having to go to work, which means I do leave quite frequently, but to do other things, yeah, no. There's a lot of things I still just will not do because it's just simply not safe. You don't know if the next person coughing to you, the person next to you coughing, is COVID positive, flu positive, RSV, or God knows what. I mean, yeah, there's a lot of people reluctant, and you know what? Rightfully so, because they want to try and be safe and do the right thing. Alrighty, moving on now. The UK yesterday reported 2,932 new cases. That was down by 207. Let's take a look now at the pollen levels, which, by the way, we are putting this in hibernation pretty soon, but a little bit of an increase today, or at least an expansion into yellow in Texas today, and portions of Arkansas, Oklahoma, New Mexico, and a little bit of yellow in Florida. But I think starting next week, unless I see something pop up on here, I probably am not going to be showing this again until things start picking back up for pollen levels, which probably won't be until next year, but who knows, maybe something by surprise will pop up. Taking a look at air qualities around the U.S. for today, and I do need to refresh this as it goes gray about every 5 minutes. And taking a look at air qualities, you're going to see there are a few concerning areas. In the west and the Pacific Northwest, we still do have some air quality concerns, some areas which are still in the red, and then from Texas on through to about Georgia, there is some minor concerns at this time, just some very minor concerns in the Northeast, and quite frankly, it's just a few stations, so I'm not even really concerned about it at all, and elsewhere is doing relatively okay. Taking a look at my other place you can follow me on, which is X for Climate Data Report. Yes, all things climate and weather. You'll want to follow that and my other account over there on Blue Sky, because I'm going to be talking about a lot of weather this weekend. We have a tropical threat that could eventually make its way into the Gulf. We have severe weather in the plains, flooding, snow in the Northwest. Yeah, a lot going on. And you also want to follow me over on my weather YouTube channel, where I will be talking about all things weather this weekend. I just did a video a few minutes ago. Go check that out if you want to know what's going on with the tropical threat and anything else weather in the United States. Philadelphia yesterday had 792 EMS calls. I honestly thought this would be a higher number because locally I wasn't listening to the scanner activity for the medic bands, but locally I heard a lot of ambulances yesterday, and I honestly don't know if this includes the private EMS, because we do have a couple private near me. There's one just right behind me, and I saw them go by a couple times yesterday. And then there's another private about maybe 1.5 miles, 2 miles east of me. So I don't know if this count includes private, but hey, 792, I'm happy about that. Taking a look now at what is going on currently in Montgomery County, Pennsylvania, and hey, less busy today than yesterday, and I've been checking in on this a few times today. A couple respiratory calls, cardiac emergency, and a few other things, but nothing like what we were seeing yesterday. However, the same cannot be said for Chester County. It's a very busy afternoon, and this has been going on for at least the better part of an hour to 90 minutes. Now you can see multiple overdoses. We see sick person not once, but twice. Respiratory emergency 1, 2, 3 times. Diabetic emergency. Heart problems again. And heart problems actually 3 times. Yeah, just very busy right now, Chester County, Pennsylvania. And I will tell you one place that is going to be extremely busy this weekend, and we'll take a look at that on the Pennsylvania Wastewater map. That is Center County, Pennsylvania. There is a huge football game, probably one of the biggest Big Ten football games of the season. Penn State plays Ohio State, plus ESPN College Game Day is going to be there, plus Fox Sports Big Noon Saturday is going to be there. So, yeah, this is a big deal. I mean, there's going to be a heck of a lot of people up there. It's going to turn into the 3rd biggest city in Pennsylvania. That's what happens during these big football weekends up there. So, we'll have to keep an eye. I know that area had a huge summer surge, but you know what? It's not even all about COVID. Other viruses could really start spreading there as well. And then, of course, people don't just from locally in State College. Oh no, they come from all over. They come from Southeast Pennsylvania. People will come from Ohio. They come from Western Pennsylvania, Northeast Pennsylvania. A lot of people go in there from New Jersey, New York. So obviously it's something of concern, and we'll have to keep our eyes on that. I will definitely have EMS scanner on for that this weekend over at, what's the name of the website? Broadcastify. I will definitely be listening to that this week just to hear what goes on. All right, up in Canada, the COVID viral activity level, take a look at this. Good news, is now down to low. Flu A is low. Flu B, for whatever reason, not being detected. I guess that's good news. And RSV, look at this, is now listed at moderate. All right, let's take a look at wastewater And this site I have picked out here is in Michigan. I'm a little concerned about Michigan. You can see here, it is saying high for COVID, no trend in the last 21 days, and high concentration. But if you go to the shorter term, it is starting to go up. So I'm not happy that it's starting to rise and already is listed as high. And Michigan did get hit pretty hard with their summer surge. This is a smaller site, 21,690 population. RSV is still low. Influenza A is still low. Influenza B, HMPV, all listed low, and even norovirus is low here, which, quite frankly, that's a really good thing because there's so many places where norovirus is listed at higher. But now let's go down to Florida, and I hope I click on the correct wastewater site. Could this be it? Southwest Orange County? I don't recall, but there was a wastewater. Yes, this is it. Southwest Orange County, which is in the Orlando area, 50,000 population, and take a look here. It is already starting to rise, which seems to be early for Florida. I recall in previous years, Florida wastewater sites don't really get going until, say, on or about just after Thanksgiving. So that's something we're going to have to keep our eyes on. And remember, for all these wastewater sites and anything I'm showing you today, any effect from Halloween will not be felt until at some point next week, or maybe even the end of next week. We're not going to really see any effect from Halloween just yet, at least not in today's data, because Halloween was just yesterday and the parties were last weekend. There may be a few straggling parties left behind that still occur this weekend. RSV at this wastewater site, low. Influenza A, Influenza B, HMPV is low. Norovirus is high at this time. And that is something that we have to keep an eye on as well. Alrighty, moving on now to Walgreens, where we will take a look at a couple things here on Walgreens. The national positivity trend is 15.9%. That's the COVID positivity rate for the United States in COVID testing at Walgreens. Prior week is 16.2%. That's a difference of down 0.3%. Total test, 4,675 versus 4,551. And you can see here, there are some areas that are starting to increase at this time. You see like California, Pennsylvania. We also do see Kentucky, Tennessee. Let's actually click on Tennessee. And in Tennessee, look at this. It is up by 4.3%. 16.7% this week, 12.3% last week. But you do see here, total testing did drop at that wastewater site. Let's take a look at what's going on in Utah. 14.7% positivity rate there. That's down significantly, and testing did go up at that in that state. So that could be part of the reason why it is down as much as it is. Did not get an update on this today. Did not expect one, and this is the latest variant update, which comes from last week. This is something that updates every other week for COVID. KP 3.1.1 is at 57%. XEC at this time is at 17%. Then you have KP 2.3 at 5%, MC.1 at 5%, and a bunch of other variants that are lower at this time. Take a look at this. This is emergency department visits for people diagnosed with COVID. It continues to drop, and it looks like it has dropped a little bit more. Maybe it has picked up the pace a little bit in its drop. So that is some good news. We'll take a look at all the states tomorrow. Of course, there'll probably be a few that we cannot look at, like always. Missouri would be one of them. I think, where's the other one? Wyoming, or one of those mountain states. Yeah, for whatever reason, it's always, just doesn't really show up. Alright, take a look at the national COVID wastewater viral activity level for the United States. It is listed at low at this time, and it does continue to drop. And we can see here, there are now 460 dark blue sites and 519 medium shade of blue sites. That means really low levels of COVID. Only 5 red sites and 40 orange sites. That is some really good news. This is the best this map has looked since spring. Alright, taking a look at trends in epidemic status, we do see growing now for COVID in Tennessee and Louisiana, likely growing in Arkansas and Illinois, and it's still likely declining in several states, and we do see many states that are not changing or just not estimated. And when we come down to flu, well, we see a lot of states now that are growing or likely growing, several in the east, several in the southwest, several in the south, but you can see here the Pacific Northwest, Oregon and Washington, not changing just yet. The plains, a lot of places where it is not estimated as of yet. And taking a look at that flu map now, we do see New Jersey has now moved into low category, as has a few other states such as Georgia, Virginia, Indiana, Ohio, and let's see, Connecticut as well. And then we do see moderate in Washington, D.C. at this time. All right, let's take a look at some data now from CJS A3172. Daily, weekly reporting states. Florida, 49 new deaths were reported yesterday, 15 of which came from July. I don't know what that lag is all about. New Jersey, 367 new cases and 3 new deaths. New York, 788 new cases. Puerto Rico, 201 new cases after adding 203 yesterday, which he had forgotten to mention. Hey, that's fine. You do such a great, fantastic job. I'm glad we get these reports. Weekly reporting states. Connecticut, 629 new cases and 1 CDC reported death. Georgia, 1,058 new cases and 11 new deaths. Kentucky, 808 new cases and positive tests and 15 CDC reported deaths. Massachusetts, 1,013 new cases and 9 new deaths. Minnesota, 1,122 new cases and 16 new deaths. North Carolina, 423 new hospital visits and 21 CDC reported deaths. Nebraska, 255 new positive tests and 5 CDC reported deaths. Ohio, which is mentioned late yesterday, I did mention it, they had 2,779 new cases and 29 new state reported deaths. Oklahoma, 16 CDC reported deaths. Utah, 277 people added to their, quote, living with COVID tab and 5 new deaths. Alrighty, let's check on New Jersey for today. And you'll see in New Jersey that not all the hospitals reported, and it was 58 out of 70, so that's a low number. We are supposed to get, I forget the precise date, but at some point in November, all hospitals in the United States will be mandated to report once again. So, yeah, 157 hospitalizations, which, quite frankly, they probably are still dropping, but it's still 12 hospitals are missing. It's just ridiculous. New York State, 567 positive tests, and we do see here they continue to drop a little bit, but again, any effect from Halloween would not show up until next week. But for the moment, hey, they're still dropping. Take a look here in the hospitalizations, and we see here 534 people hospitalized, 70 people in the ICU. The ICU number did go up ever so slightly, so I mean that's not terrible, but hey, whatever is what it is. New York State overall is still dropping. And let's take a look at LA, and we do see here hospitalizations in LA. They're not dropping as much now, and it does look like deaths have gone up ever so slightly, at least on this chart, and cases are slowing off, but they're still dropping. Testing positivity rate has started to go up ever so slightly. Not terribly even concerned about that just yet. It's more so bouncing off the bottom. Wastewater still dropping. Emergency department visits are still dropping at this time. Finally today, let's take a look at California. The positivity rate for COVID is 3.2%, flu 1.7%, and RSV is 1.7% at this time. And it says here COVID wastewater is low and plateauing. So yeah, really some good news out of California. No major increase. All these increases in positivity rate are very minor at this point, with the biggest being for RSV. Alrighty, folks, that does it for the Friday edition of the Virus Update. We'll have updates throughout the week, and another one tomorrow, and on Sunday, I'm sure I'll find quite a few news stories for tomorrow. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic weekend, and thanks for watching.